नाम वाम नहीं बोलना, ठीक है, चलो जी. This patient is married for 4 years with primary infertility. There is a fibroid in the posterior wall of the uterus. This is the fibroid posterior wall of the uterus compressing the endometrial cavity. This is cervix. You can clearly see the cervix. This is lower segment of the uterus, endometrial cavity. Here in the mid of the uterine cavity, the fibroid is compressing this area of the uterine cavity. Let us check on 3D 4D. So this patient is primary infertility 4 years with large Figo stage 3 fibroid compressing endometrial cavity. Let us see how much it is compressing on 3D 4D. This is the 3D 4D ultrasound. So we are expecting that only lower part of the uterine cavity will be visible, the rest of the cavity cannot be seen. So let us check where is the uterine cavity. As expected, whole of the uterine cavity is being compressed by the fibroid. This is the lower part of the uterine cavity which is visible. This is the cervical area. This is the vaginal part. This is the cervical area, and this is the uterine cavity, lower segment. This is the whole of the fibroid compressing fundal part of the uterine cavity. Hence, in such a patient, such patient is the most such a fibroid is one of the important causes of abnormal uterine bleeding or menorrhagia, menometorrhagia. Also, such a fibroid can cause infertility because it will not allow the this embryo to implant in the uterine cavity, as it is occupying the area of implantation of the uterine cavity. Plus, this fibroid can also lead to recurrent pregnancy losses because of impeding the implantation of the developing embryo. Fourth most important thing is that this fibroid can also lead to IVF failures because of hampering the implantation in the endometrial cavity. See, again we'll see this on 2D grayscale. This fibroid, big fibroid, from here starts the endometrial cavity. Here it is being interrupted by the fibroid and pushed anteriorly. This is pushed anteriorly. There is no free space between the endometrial cavity and fibroid. Again we will do 3D 4D ultrasound to see whether any of the endometrial space is left or not. Practically none. Practically none. Let us check if any of the endometrial spaces is left or not. No. The fibroid is completely compressing the endometrial cavity. Now let us check for the ovaries. Again she is she is an advanced maternal age patient with diminished ovarian reserve. Right ovary, left ovary is very small, almost menopausal. But a period she haven't checked son regularly she haven't. No. So again she is having diminished ovarian reserve. So this is the left ovary, this is the left ovary. Okay, practically zero follicle count. So she can either go for donor egg IVF. Donor egg IVF being un-Islamic, we are not practicing it, or from Islamic perspective she can go for PRP therapy. If eggs develop, then she can go for self IVF. Okay, this is the right ovary. This is the right ovary. Again, a right ovary, practically zero follicle count. So two types of treatment, either PRP therapy for self IVF or donor egg IVF. For that, PRP therapy is not needed, but we are not practicing donor egg IVF at all. Another small fibroid can be seen here, anterior wall, just in the lower uterine segment. So one of the important complications of the surgery is that opening of the uterine cavity. Opening of the uterine cavity, or while doing endosuturing, there may occur, suture may be taken in the endometrial cavity. That should not be a worry for us. Okay, done.